Now, we're going to be taking a look into the world of cosmetic surgery over the next couple of weeks, and this time around we're looking into Mantox and what it's all about. Take a look.
Dr. Meagher, we're here to talk about Mantox today. Now, Botox is something we know a lot about. From my own point of view, more so from the female side of things. So Mantox, it sounds very interesting.
Absolutely. Well, obviously Mantox is male Botox. A lot of men are finding that they look stressed or tired, or they look unapproachable. You know, they will have the lines between the forehead, and it just makes them in the workplace just look a little maybe frightening or a little unapproachable. And obviously at the moment everyone wants to look like they're on top of their game and they're not stressed out. So a lot of men are seeking these treatments. It's the fastest growing treatment in Ireland at the moment, and a lot of men are seeking these treatments so that they look a little bit younger, but also more approachable. It's almost like an investment in their career.
Okay, a little fresher, which is what we like.
A little fresher.
And do you think men are a little bit afraid of this because it's always seen as, you know, more so of a female thing to get done?
I think it's funny, when we introduced it, I really wasn't sure what the uptake would be. Now, it's definitely not 50-50. Okay. You know, the percentages may be 20, 80%, so probably 80% of our patients are female, having, you know, female ladies having Botox. And about 20% you'd be surprised. You'd also be surprised who is going for the Mantox. You know, it's everyone from somebody who's a coach driver to somebody who owns their own business to a lot of bankers.
Really?
Yeah, I don't know if that's...
Well, they do look stressed.
They are a little stressed at the moment. Maybe they want to beat their recession wrinkles, you know. But yeah, you'd be surprised actually at our clientele for the Mantox. I would have, you know, I wouldn't have necessarily thought that it would have been the men who come in, but it's bankers, it's lawyers, it's, you know, it's salesmen.
Vast array of people.
Yeah.
Now we have the lovely Brian Fallon with us today. He's one of Ireland's top models. Brian, can I ask you, you know, what took you to the chair? Why do you want to get this done today?
Well, for the record, I'm terrified.
No, we'll mind you, we'll mind you.
And I don't know, I'm in my late 30s now, and I found that the old smile lines are getting a bit deeper.
Okay.
So, but I don't want to lose them at the same time. So I think just to soften them a little bit, I think.
Because obviously modelling, it's important that you look fresh.
Absolutely.
It's important that you look good. So this is to do with your career as well.
That too, yeah. It's, well, hope it means I can do it for longer, you know.
Okay. I mean, I think that's very important, you know. The whole idea of, you know, look, 15 years ago in California, it was all wind tunnel, frozen face.
That's, you know, one thing I definitely don't want.
That's long gone. No. Less is more.
You don't want Bruce Jenner.
No.
Yeah, less is more. Less is more is always the key. A natural look. What we want to do for Brian is stop him aging any further, and we also want to ease the lines. We don't want them all gone. You know, we
so
want a natural look.
So what would be the areas now that you'd be looking at?
So with Brian, we'll obviously, there's the line. A lot of people, men and women, will have that vertical line going down between the eyebrows. Obviously, you can see there's a number of horizontal lines, or rhytids, as we would call them in the medical world. So you can see the lines along here, and obviously the crow's feet. If you do a big smile, Brian, that's great. So it's quite obvious along here. So again,
a lovely model smile.
Yeah, lovely smile. And the thing is, again, to ease those lines. It's not to eradicate them or give a frozen look. And in men as well, we keep the treatment much flatter. In women, we sometimes go for a brow lift. With men, it's just very flat and very natural, you know. And we won't get rid of all the lines.
I will still have movement in my.
You will still have movement. You'll still have movement, less is more. And what I do is, as well, when a patient comes in the first time, we'll do a treatment. We'll normally review it 2 weeks, because then we can always top up. You know, you want a natural look, you can always top up, but you obviously can't go backwards. So the best thing to do is do a baseline treatment and then review in 2 weeks and a top up. And if a top up is needed, then obviously we'll do a top up.
And how long does this last for?
Normally with Botox for men or women, the first time you have a treatment, it'll be about 4 or 5 months, and then you'll normally get to every 6 months. You know, and a lot of people say, oh, you know, it's expensive, but if you think about it, maybe it's 500, 550 euros, you know, twice a year. But I mean, I know even a lot of people will say they spend more on their hair or their nails, and I think at the moment as well, a lot of people, they don't have the budget for new clothes and new shoes, so they're kind of going back to basics. They're in the gym, they're training, they're out cycling. You know, they're just looking after themselves, and I think it's really important to note that with Botox, you know, you're not going for the frozen look. It's not about that. It's about stopping you aging any further. It's about catching you young. You know, it's not, when you're at a certain age, there isn't a lot you can do. Whereas if you're caught in your early, mid, late 30s, you can stop your face aging any further, and you can also grapple back a few years, which is nice.
Well, before Brian gets too nervous, let's just get going with this now, and we'll see how the treatment looks afterwards.
Sure, no problem.
Mar, that was a very fast treatment. What exactly have you done, and when can we start to see the effects of this?
Perfect, no problem. What we've done today is obviously for Brian, we've treated the upper part of the face with some botulinum toxin. We've treated the forehead, the frontalis muscle, the procerus muscle, the orbicularis oculi muscle, which is that circular muscle around the eye. And what we've done is we've put the botulinum, or the Botox, into the muscles, and over the next 3 to 14 days, it'll begin to work. Day 14, we'll probably review Brian, and we can always top up if we need to, but the key is obviously less is more. On the lower part of the face, what we use is DermaFiller, and that's the hyaluronic A substance. We've used Juvederm 4 today for Brian. It contains lidocaine, so it means it's a pain-free treatment. You know, obviously you'll still feel a little bit, but it really takes the edge off it. And the Juvederm product is actually from Allergan, the makers of Botox, obviously, who've been making Botox for 30, I think it's on the market, 32 years now. So again, here at Dermadental, we like to use the best products, the safe products, the FDA-approved products, you know, and that's the key to it.
And you did talk about it being pain-free, Brian. You will give us the honest truth. How was that?
It's just like little mini pinches, that's all. So it's easy enough, yeah, it's fine.
You know what they say, no pain, no gain?
No pain, no gain. Well, listen, we will look forward to seeing you on the gracing all the magazines now.
Oh yeah,
fantastic.
looking good.
Thank you.
You're very welcome.
Well, there you go, that's Mantox. And as I said, we're going to be taking a look at a number of other procedures over the course of the coming weeks and see what they're all about. Now, we're going to take a quick break, but Olive will be joining us afterwards. As I said, she is cooking up a storm at the Chef Centre of Ireland, and this time she's making some delicious desserts. We'll see you after the break.